Now, one thing that we can actually do is to marry the techniques. Okay? And so if we can use something that is the least invasive but opens up the functions of the sinuses so they can work well and people can get back to their lives sooner and faster and enjoy life, this is one of the options. And so there's different ways we can do this. It can be done with something called the Luma, which is a guided light. It's not really shown here, but what the Luma does, and we'll show some animations, it actually goes through this port here, it goes through this flexible catheter, and this goes into the sinuses, and you can illuminate the sinuses. It can also be done with a radiographic guide wire and their fluoroscopy, which is just a fancy word for saying that you have a movable x-ray, taking pictures when you're in the OR. It's also engineered for, again, different various sizes of balloons, which you can actually see here. We don't have a model that just one fits all. There's different lengths. There's different cannulas to cannulate different sinuses. There's also this apparatus here, which can go into the sinus, which is an irrigation system, which basically they call the vortex, that allows you to irrigate a lot of copious materials out of the maxillary sinus, that you've created this nice gentle opening for the patient. You even have a way to, if you want to, deliver medicines, although at this point in time it's not FDA approved for all the medicines that would be used, but that is just one possibility. And we're hoping that that'll happen soon. This is just an animation.
The sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medication such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostrils.
This is where the bone is left and it has to remucosalize.
Recently, a less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
Once this is performed, the mucosal lining is still intact, and so there's no osteotic changes or infection of the bone that occurs. So it's a really elegant technique. This is just another illustration of that. And you can see here, this is going into the maxillary sinus, and if you look here, you can actually see that it's dilating and opening up. You don't see any blood. You can see that this sinus is now open and can drain properly. There's minimal trauma to that area. Again, this is very similar to, and this is a technology that's used to unblock hearts. And this is the conventional way, which is a very good way, and it's still appropriate for certain instances. But you can see that there's more bleeding. This is what we call the pediatric backbiter, and this is what's going through what we call the unsnake process. And pretty soon he's going to bring in the microdebrider here, which again, it's still a good technique, but it's more traumatic. We're starting to get into the maxillary sinus here, but there's still this remnant of the unsnake process. And this is a microdebrider. It has a vacuum. Basically, it's what was used in joints in the past as well to get rid of cartilage that was in the knee, so that if you had a locking knee joint from the cartilage, this type of apparatus was also used. But you can see that there is some exposed bone, there's a little bit more bleeding, and it's a little bit more traumatic. So there are some benefits to using the balloon sinuplasty system. It's safe and it's effective. It's minimally invasive. It reduces the bleeding, and it improves the recovery time. And it doesn't limit you from other opportunities and other techniques if the patients require further surgery or techniques.
I think it was about 5 years ago I had my first
feel.
sinus infection. And I never had a sinus infection before and had no idea that they could be so painful. So I went to my regular doctor and got on antibiotics and nasal sprays, and that seemed to fix it for a while, and then it came back a few months later. Antibiotics again, more nasal sprays, went away, came back. Pain. You get horrible headaches, your face hurts, you're puffy a lot, you are tired all the time. It's really wearing and fatiguing. And I have to travel a lot for business, so when you hit 35,000 feet and you've got problems with your sinuses, it's really not pretty. It hurts. I think we tried pretty much everything in the arsenal, and then he started talking about surgery, which I really didn't want to have, and because cutting into your nose that close to your eyes and your brain seems a little scary. When my doctor first explained the balloon sinuplasty to me, it made a lot of sense. It seemed lights went off in my head. Well, gosh, why did it take them so long to come up with this? Because it seemed so logical. And I had heard of people having procedures done for clogged arteries and heart problems. And it just seemed to make sense. If you can put something in there and clear out debris in a little tiny vein or artery, why not in your sinuses? So I was definitely interested in doing the least cutting possible. And balloon sinuplasty was definitely better than the traditional alternatives. So I think it's great, and I think it's going to benefit a lot of people. So after I felt so much better that this has been the best summer I've had in 10 years, I've been able to spend a lot more time with my family. I've been able to ride my horse again. It feels great.
So this is just one testimonial, but actually we have lots of patients that feel this way. I'd like to go ahead and open the forum up for any questions. And one thing I would just let you know before we take the questions that we are videotaping this. And so if there's anybody that has any concerns about the videotaping, their voice or not wanting to be on, please let us know. But if you don't, then I just want to go ahead and let you know about that. Question?
My first question is, how long have you been doing this?
The balloons or sinus surgery?
The balloon.
And the balloon technique has actually been around for a few years. I've actually been doing it off and on for the past few years. The issue with the balloons is they are expensive. Okay. The other thing about the balloons is that you have to make sure that the technology and the papers were up to prove that this is the case. As a matter of fact, I will just go ahead and show you here that I didn't jump on the bandwagon the very first time. I've practiced long enough that I've learned to make sure that the technology is something that I want to offer my patients, and I would want it offered to me. And so I want to have some proven information, some literature to support it. And there's a lot of literature that is out there, and so I'm just leaving this up here. There's a plethora more than this. But I wanted to be convinced that it was safe and effective, and it was in the best interest of the patients. And so to answer your question, I've actually been doing this off and on for a couple of years now. But again, it's one of those things that I just wanted to let you know that I didn't jump on the bandwagon the very first time. And I don't do that with any of the technology. Even though with the transoral robotic surgery, I'm the first one here in San Diego County doing it, I didn't jump on the bandwagon without doing some thorough information checking out. And then also looking at the conventional techniques and see if this has a better way that I can provide more effective and safer care for my patients. Lady in black.
How many of these have you done? How many of the balloon sinuplasties have you done?
The balloon sinuplasties, I believe I've done about 30 of them, and I haven't had any complications. And I actually did the first one that I know of, and I don't know if Benjamin knows if there's any others. The first one in the office on a patient with cancer. And so I did that not because I wanted to do it, but it was in the best interest of the patient because he was not a good candidate for the general anesthesia. And he didn't want to undergo that, so he was willing to undergo it in the office and received excellent relief. Did I answer your question satisfactorily? Yes.
Where does the balloon go through? Through the nose or the mouth?
It all goes through the nose. If I will
Through the nose.
Go back, well, it goes through the nose. I will go back here. So this is actually going through the nasal cavity. Now, in this case here, this person has no problems with their septum. Okay? So if there's no deviation of the nasal septum, then you don't need anything else to gain access. If you have a deviated septum where, let's say, the septum is blocked over here, and you can't access this, what you have to do is you have to do a septoplasty, which is mobilizing the partition that separates the two halves of your nose over so that you can gain access. But we do that with functional endoscopic sinus surgery as well. And this is actually all done through the nasal cavity. So there's no external incisions with regards to this.
So you don't cut anymore?
No, there's no, that's, no. The times that I do call lugs underneath the lip are for cancers, where you need to have access, and there's a totally different method and purpose behind your technique.
What's the cost?
The cost, I don't actually have the cost off the top of my head, but what I can tell you is that most insurance carriers do cover this. As far as I know, there is one that there's still some issues with. And if you can correct me, Benjamin, if I'm wrong, I think it's Blue Cross in California. There's still some issues that they're working out with regards to that. And it's actually interesting because if you look at the whole way in the system of it, it's actually more cost effective to do it this way because there's less complications, less risk of complications. So overall, patients do well. Why Blue Cross does not want to allow it, I can't answer that. Although they're certainly looking at it.
My question is pretty basic.
Sure.
This spring I had a bad infection in my head up here,
Mm-hmm.
and the doctor called it rhinitis.
Okay.
What is the difference between sinusitis and rhinitis?
Well, you know, that's a very basic question, and it's kind of like a child asking, where do babies come from? The reason why I say that is, it all seems very simple. When you start with a process and you see something, you say, what's the difference? You know, I have a lot of people that come in and say, I have sinusitis. Well, they don't have sinusitis, they have rhinitis. Rhinitis, if I can go back, I'll just go to here, hopefully it won't play. Rhinitis